So thank you for joining us, everyone. I'd like to introduce you to Deidre Lake from the Alberta International Medical Graduates Association, which I believe is a nonprofit association that helps foreign trained doctors obtain their credentials and licensure to practice medicine in Canada. And then we actually have a real live internationally medical graduate, Dr. Elizna du Plessis, who recently started working, I believe, in the Alberta health sector at Grande Prairie Rapid Hospital. And you could kind of maybe put a face to like the experience. Um, but Deirdre, I'd really like to start with you and just, I have a feeling that every time that somebody asks you how to become a doctor in Canada, you'd be very wealthy right now. But just first of all, talk to us about your organization, what you do, and we'll go from there.
Yes, so first of all, I'll give the short name. I'll refer to us as AIMGA as it is a
Oh,
long name. But what we do is we support internationally trained physicians who are looking to work in Canada. And so we have over close to 2,500 active members that are currently pursuing either licensure or alternative career pathways in health. And you're right that, so we provide all kinds of supports, at every step in the process. Our main mission is to make sure that internationally trained physicians are making informed choices around their careers and that they understand the pathways to licensure and what the requirements are and whether or not they meet the sort of eligibility criteria. Of course, at the end of the day, it is the regulatory bodies across Canada that decide whether someone is eligible to practice or not. But we help advise, we work with various regulatory bodies, mainly the CPSA, which is the College of Physicians and Surgeons of Alberta, because most of our members, we started in Alberta and now we do serve IMGs across Canada, as well as overseas who are thinking of coming and provide support such as exams, exam support, and so on to help pass exams while they're in the country where they're practicing, and they're able to pass those exams prior to coming, which will save time in the process. It can be a lengthy journey for some people, but South Africa is one of the approved jurisdictions, and so there are some advantages, of course.
okay. Deirdre, why don't we quickly just take a big macro overview of the current healthcare system in Canada, obviously provincially regulated, but we hear that Canada is short anywhere between 40 to 50,000 nurses nationwide. There's somewhere a shortage of 20,000 physicians. Um, you know, IRCC finally came out with the category-based selection for express entry, which most people in South Africa would see it as a critical skills list, right? And
Mhm.
every type of doctor, healthcare worker, basically frontline healthcare workers on that list. But from your own perspective, what is the current state of the demand for healthcare professionals coast to coast in Canada?
The demand is absolutely there. I think that there are routes like the practice readiness assessment route, which we have here in Alberta, that assesses sort of specialists and family physicians to practice. Um, that there is a dire need. There are many communities that are short of physicians, and the practice readiness assessment route is a route that basically has been designed to get doctors where doctors are needed. And in the past, we've had sort of an oversupply of physicians in urban areas and then an undersupply in rural and remote areas. But at the current time, we're facing sort of shortages, in both urban and rural areas. And so we may see in the future that some of these pathways that were mostly getting doctors into rural areas may open up opportunities in urban areas as well as a result of the demand. So the regulatory bodies and the health systems do work together to determine where there are shortages, and there are some critical shortages, and particularly in certain areas, for example, or certain specialty areas like anesthesiology or something, along those lines. So, in terms of just going back to the overview of sort of, licensing in Canada, it is currently done by province. And so that makes it a little bit complex for people to navigate licensure pathways, because it will depend on the province in which you wish to reside or wish to practice. And so what we do at AIMGA is we meet with internationally trained physicians to find out what their goals are, whether they have a specific destination in mind, or and to look at their postgraduate training as well as their work experience and their goals, and then to determine which pathways in which province they would likely want to consider. If you're a specialist, then there are limited opportunities, and so Alberta is one of the provinces that we would recommend, because as a specialist, they do recognize internationally trained physicians and assess them, for their qualifications to practice, such as Elizna and Grande Prairie.
So when dealing, Beaver Immigration's experience when dealing with medical professions in South Africa, they do their research. So when they come to us, they're prepared.
Mm-hmm.
And one question that we get asked a lot, and it's a technical one for you, Deirdre, is in terms of the licensing, it's been our experience that it can be very fast or very slow. So my question to
Mm-hmm.
you is, how does licensure become affected when you receive a job offer that's supported through an LMIA or a provincial certificate versus coming through express entry and just coming to Canada, arriving to Canada as a PR? Can you add some commentary on that?
Mm-hmm. So what I would recommend people to do is to look at, whether or not they are eligible for practice readiness assessment routes, which, South Africa, like I said, it's been deemed an approved jurisdiction, in the province of Alberta, for example. So one of the things that regulatory bodies will look at is they'll look at postgraduate training to find out, is the training of this individual similar to the training of a Canadian medical graduate, for example. And so they look at the rotations, the training, and so they go back and they really compare the training. The unfortunate part is, work experience isn't always considered. So whether you have 1 year of work experience or 10 years of work experience, the work experience, will matter, of course, when you're dealing with patients and in practice, but that's not looked at. It's really comes down to the postgraduate training that people have undergone. And then they'll apply for an independent license. And if they're not eligible to go into direct entry and to practice directly in the system, then there's this practice readiness assessment route, which then will include, an assessment for some people, and for now, some people the assessment period is being waived. In order to get people into, a position sooner as opposed to later. So there are changes that are happening there. And some of the exams are also waived at the current time in order to get people, into those positions as well. It doesn't mean that those exams they're not necessarily required later on, because when you get into this practice readiness assessment route, you are working under a provisional license. And then you generally work under that provisional license and are in a contract where the best way to think about it is it's a jurisdictional license. So you're licensed to practice in that particular jurisdiction for a period of time. It can be anywhere from 3 years to 5 years. And then in the meantime, you can take the necessary examinations to move to the general registrar, which then allows you mobility after you finish, sort of the not return of service, but that contract with that, under that provisional license. And then you can move into sort of, looking for jobs elsewhere if you wish to, relocate or that kind of thing. So, I have talked to people on the phone, a pediatrician, for example, who was from South Africa not too long ago, and told them about the PRA route in Alberta, and they were approved within, less than a month. And then after that, there's the job of finding a sponsored position in order to And that's a sponsored position is a position that has been made eligible for those folks who are PRA eligible or Canadian medical graduates, whereas some positions in the system are only available to Canadian medical graduates. So that's sometimes the difficulty where, depending on the specialty area that you are in and the job opportunities that are available, some of those are available now, some of them are not available, and then that can sometimes be the difficulty or the challenge for some.
Deirdre, based on your experience, what is the best advice you can give to an IMG, whether it's in South Africa, India, or anywhere in the world? What should they expect? What are they signing up for? Like, how should they prepare themselves, mentally and with the family? What's your advice?
My advice always is if people are calling me when they're overseas, I tell them to sort of do the necessary steps, as many of the steps that they can while they're currently, practicing, because a lot of people sort of underestimate the length of time that it may take or the resources, the economic resources that are needed in order to pursue licensure. And so I encourage people, if they're able to do the exams prior to coming, then take all of those necessary steps so that it's not as large of a burden when you first arrive. The other thing is that we are happy to connect people to others who have gone through the process, who are practicing maybe in the areas that the individual is interested in practicing in, also, or have gone through a similar pathway, just to get that firsthand experience of what it's been like for other people and what to expect. For some people, the weather can be daunting, of course, and and so I think I do think that the municipalities and different organizations are there to support physicians coming to communities where physicians are needed, and so some communities will have greater levels of support than others, and look for opportunities for children, for spouses, and different things like that. But again, the experience will vary depending on the location and the pathway.
Okay, great. So we have a real life case study here of a South African coming to Canada. So a question, Elizna, my burning question to you is, what's life like in Grande Prairie? What was it like getting off the plane? Did you experience culture shock? What was the transition? Just tell us like how you felt.
All right. Well, life in Grande Prairie is so far so good. I really cannot complain. My journey getting onto the plane has been quite a long and arduous journey. However, ever since we've arrived here, we've really been well supported and just taking it one day at a time, integrating and getting your roots settled. From both the personal and a professional life. It's been really going well. Things have been falling into place. There is quite a bit of culture shock in areas where you wouldn't expect. So generally, everybody's been very supportive. It doesn't matter if it was somebody at the bank or somebody from the work. They have really been very accommodating. People, when they hear you're new to Canada, they want to know, how can I help you? Like, welcome to town. And when they hear you're a physician, they're even more excited. So that's been really helpful. This town is also a nice sized town. There's a lot of good recreational opportunities, and even though you're in the prairies and it looks a little flat around here, you're still within a weekend away of beautiful places like the Rockies. So it's really been an amazing experience to start getting settled in. And we've just really received amazing support along the way. So wherever we feel there's something a little bit different than what we used to, there's always somebody that you can just feel free to ask, oh, please tell me, I'm new to this. Can you explain to me how it works? And it's very, very straightforward when somebody just explains to you and you're like, oh, okay, it's just different. as in a little silly example, as a little bit of culture shock, like we used to never get physical mail in South Africa for the past like 10 years or so because you just don't trust the postal service. And here, you kind of need to make sure you need a mailing address because everything will be sent to you in the mail. It's reliable. Silly things like, not knowing that, no matter how many like resources you read or people you talk to, like just getting here, taking it one day at a time, has really been a journey, and so far really can't complain. So
Elizna, a lot of the questions I want to ask you is really an amalgamation of the questions we constantly get from physicians.
Sure.
And the one we get asked a lot, and we don't always know how to answer it, just from a purely professional perspective, what's it like working in a Canadian hospital, let's say the global north, versus your experience in South Africa?
Yeah, so the first obvious difference that struck me coming here, even with the site visit before I started working here this year, was the fact that the hospitals are truly paperless. And that was not something I was familiar with in South Africa. All the records are electronic. So you have to, when you get here, actually get training like full on for a couple of days just to get to know the electronic medical record system. And it does take a couple of weeks to adjust to that. There's lots of other differences, particularly in the hospital I work in, the Grande Prairie Regional Hospital. It's brand new built. We've only moved over patients less than 2 years ago. So the fact that it's a beautiful building and there's windows I work in the operating room area of the hospital, and I never used to have windows where I worked in an operating room, and this new hospital has windows. It looks and feels really nice and fresh and clean, and a nice environment like that does make for a nice working environment. Whereas in South Africa, I only worked in state sector, just need to declare that. It was quite different. The structure and organization that you experience here is a lot more obvious, and you feel it when you walk in that there is a specific point for every need that you have. If you have a question, there's a resource for it, or there's an office or department for it, which I didn't really feel like before. The human resources departments with hospitals in South Africa, I felt was a little bit of a mystery to you. It was that building you maybe would visit like once a year, or for a little bit of admin, but here it's just a lot more structured, and I appreciate that. Like, resources for everything exists, protocols for everything exist. If you have a question, you can just go onto your staff email or interest site and go find what you're looking for. So that was a big difference. The colleagues, look, people are still people, patients are still patients. So the actual day-to-day work is much the same. It's just the interaction and a little bit of cultural and communication differences and styles that is a little bit different that you learn over time. So that's to be expected. But yeah, the hospital itself, quite different in terms of how it functions and the workflow and the efficiency and the resources.
So, Elizna, as you know, the South African medical industry or sector is going to go see some fundamental changes. A question we get asked a lot by physicians who are motivated to leave South Africa: what's your interpretation or experience from moving to South African, which I think can be best described as semi-private, to a healthcare system that's universally accessible to all patients?
Yeah. No, the discrepancy in South Africa, it's so obvious. You cannot deny that it's a completely different world if you're a patient in a public hospital versus going into a private unit. Whereas here, it's interesting from a physician's perspective. It's almost like a hybrid between how the public sector in South Africa works, in terms of you still get compensated essentially through a government-based institution. Like in my case, it's Alberta Health Services, that the overwhelming majority of my income gets funded through there, and only a very small portion through private or other institutions. But in many respects, it's also a little bit like the private sector as a physician, where you have a business arrangement that you set up with these, like the AHS, for instance. You still have a billing solution company that assists you. You get paid fee for service, so you are still in a contract, and most of your income does get funded eventually from government. However, there's a lot of overlap also with the private sector from how the physicians work. So I've noticed that there's quite a bit of differences in terms of how that works, but it works well from what I've seen. There are obviously some limitations to that system, but generally the fact that everybody has access to equal care is really good from a patient perspective. And obviously we need a lot of family doctors everywhere. Like that was one of the culture shock things, just to go back to that point. From a patient perspective, not that I've needed to be a patient here yet, but just you can't just go to a family doctor because everybody doesn't accept patients anymore. Everybody's just so full with their own practice. So that is something that I've noticed here that is really a great need, and we really do need a lot more family doctors in most places. From what I know, definitely in Grande Prairie, we do need a lot more in the family doctor sector. So that is one thing that I have noticed since coming here that is a bit different. Whereas in the patient side in South Africa, if you're a private patient and you have the money or the medical funds to pay for your care, you can get an appointment that day at several general practitioners of your choice. So that's a bit different here. That lot more fair and equal, but there's definitely a shortage that needs to be filled.
So, Elizna, by far, the number one question we get asked of Beaver Immigration is, how do you find a job in Canada? And obviously, for the course of this webinar, how do you find a medical job in Canada? So maybe just walk us, through your journey. How did you find your job? Were you recruited? Did you apply? Like, again, as Deidre, I'm sure, would mention, there's many paths. But let's just learn about your path.
Okay. So my particular case, I was recruited. I was just sitting at work one day, minding my own business, and I was approached by a colleague that said, there's this opportunity. Would you work in Canada if you could? And I said yes. And that's how my process started. So I did not go thinking and doing a lot of research before this opportunity came along. So my process was a little bit backwards in a way, that I first dealt with people from the AHS and from the hospital directly that kind of explained to me, okay, so if you're interested, go and read up a little bit about the process, how to get here, and start opening a physician supply account. So for me, that's how my process got started. And then only later on, I realized, okay, there are websites like each province has doctor jobs or something similar that they can go and actually see which town, which hospital needs family doctors or specialists. Like in my case, I wanted to come over as a specialist. I've never worked as a general practitioner before, so that was really important for me. I did not want to compromise coming over in terms of that. So my pathway started with recruitment. I'm going through the practice readiness assessment phase, and that's my route. So I'm fortunate that I had a job offer before coming here, and it does give you a lot of security once you have arrived, that I know where I'm going, I know what I'm going to do. It's just a matter of getting through the admin processes to get your practice permit and get going. So that takes only a couple of weeks.
It seems like we did your work permit a long time ago, but if memory serves me correctly, there was a long wait time to assemble your credentials from South Africa. So the South African physicians listening to this webinar, what advice can you give them in terms of approaching their respective bodies and assembling their credentials, which are not only needed for your job offer, but also to get the work permit?
Yeah. Oh, lots of advice. Yeah, so as I alluded to earlier, it took quite a while to get all my things together just to get here. And I think part of that was because I was approached before I even thought about coming to Canada, whereas I think most people, especially if they've approached Brevi Immigration, they've already started thinking about it from their side and started doing research. So my advice would be start with all your credentials to make sure that what you already have fits with what pathways Canada have as opportunities for you. Because there are certain instances where, for instance, in my case, I was still in the process of finishing my postgraduate training and getting my qualification as a specialist when my job offer already came along. So in my case, I personally took quite a while just to get all my paperwork done and dusted and credentials in order before I could actually fulfill all these eligibility requirements. Whereas most people, I think, are sitting in the position, if they have all the credentials already, just make sure everything is up to date. You will be asked everything from your university certificates. You might be asked transcripts from your medical degrees or postgraduate training letters. You will be asked if you've specialized, your fellow from the CMSA. So that certificates, the specialist certificates, critical. So make sure you physically have that copy. You will be asked to show that you are currently registered with the Health Professions Council of South Africa. Make sure you have that certificate physically on you. And at some point, you will be asked your, I think, professional conduct certificate from the Health Professions Council. And that is something that maybe a lot of physicians don't know, but it's a time-sensitive thing. And that almost caught me out. And I had to put a lot of pressure on the Health Professions Council to get that in time, because I think the RCC, out of the blue, asked for a certificate of professional conduct, which I didn't expect them to ask in addition to the CPSA, because those two processes, from getting a work permit and getting your practice readiness assessment and registration process, kind of parallel. So I was given 30 days to get that compliance or certificate of good conduct. And I actually already applied the previous weekend before I was requested it. And it still took me, I think, 27 or 28 days to get that certificate after several inquiries, several follow-ups. So my advice would be, do not always trust the latest information when it comes to the Health Professions Council. If they say 5 days and you phone, they say 10 days. And then when you phone after 10 days to put pressure on them, they might say 15 days. And that's exactly what happened to me. So my advice would be, do what you can early, make sure it's all in order for source verification. And when they do ask you something like a compliance certificate, just know that it's time sensitive. You cannot ask for it too early, but when you do ask for it, just make sure you follow up and put pressure on the Health Professions Council in particular. I was not asked medical transcripts from my university, but if you don't have them and you just want to cover all your bases, it's a good idea just to contact your university where you studied. Ask them, please. I'm not sure if they ask a fee to be paid for that. Just do medical transcripts. And also for physicians specifically, do not get your medical credentials verified as your educational credential assessment, the ECA that they ask for in your work permit. Do not get it verified through WES. The Medical Council of Canada does that if you're a physician, so it needs to be done via the Physicians Apply platform, and it does take quite a few weeks, and they do courier the physical certificate back to you in South Africa, so to make sure you give yourself enough time to get your education credential assessment through the MCC done. And if you do that, then obviously they will check all your previous degrees. So make sure that if you are maybe finishing up specializing, that perhaps just finish that up, get your degree, and then do your credential assessment so that everything is in place.
So, Deirdre, I know you have a lot of experience with IRCC, but when it comes for the work permit, maybe you can provide some commentary on, the way what are visa officers looking for in terms of ensuring that this medical physician is qualified for the job.
Right. I just want to back up and just make one comment about the documentation before I answer that question. So for people who have practiced in various jurisdictions, they also need to do a criminal record check. And you need to do a criminal record check for any jurisdiction that you worked for more than a specified number of days. I think it's 90 days for the past 5 years. And so that can be something that's surprising to people if they've worked in different jurisdictions, that they have to go and get these criminal record checks done by those. And for people that are applying through, general practice or family medicine, they definitely have to have their transcripts, because they do look at the specific rotations that someone has had and want to make sure that they've spent a certain amount of time in community medicine or that kind of thing. So just wanted to add to that documentation, because it can be daunting and it can take time. And I know some people have had to return to their countries in order to get those documents in time, because like Elizna said, that it is time specific. So in terms of work permits, we don't deal necessarily with, sort of work permits right away, but the idea is that you're applying for a job and it is a competitive position. And so if you meet the requirements, a lot of the time, again, everything is run through, like, your source verification of your documents and your credentials and all of that are done through the MCC, the Medical Council of Canada. And then, depending on where you're practicing or where the job offer comes from, then everything goes through the college. So the College of Physicians and Surgeons of Alberta, for example, in Alberta. Now, some people can be made a job offer. I have had some people receive a job offer, but then they weren't able to meet the requirements or have the documentation that they needed in the time frame that they did, and so they've had to forego, that particular position. So when it comes to, an area that wants to, hire you, they sort of pretty much put you through the regulatory body to make sure that you do in fact have the credentials, you meet the criteria, and then from there, the actual clinic and whatnot, or Alberta Health Services, can sort of help with the work permit. And of course, having a work permit, it is, you had asked me earlier about the difference between, doing that or going through the express entry. So I think either one is an option. Of course, if you have a work permit, those could be processed, earlier, because it is a job and we do have a shortage. And, so there is that. If you come through the express entry without that, then, my advice would be to make sure that you do that you have talked to the regulatory bodies, that you have gone through, physicians apply and gotten the documentation that you need, source verified, and the credentials and whatnot, because that will. So I think, express entry is you're applying to immigrate to Canada, and the job, is sort of unknown at this point in time, or the process that you may have to take. And so with the work permit, then you've kind of gone through the process getting that job, and you're coming specifically for that job, and the area in which you're going. So I think what we normally do at AIMGA is we have immigration consultants that we put, people in contact, with to sort of help with those, with those questions. But, in the express entry, again, this is something that's relatively new, but it's been done before, by IRCC, and, certain, certain skills and whatnot are needed. And so it is based on needs. So I would just say, for people to connect, with an organization, like AIMGA, to get the information that they need in order to, make it as seamless as possible for when they do arrive. And and once they sort of make that decision, then they can start with the process if there's certain exams that they need to do, and that kind of thing.
Okay. So before we conclude, I know AIMGA has open houses, virtual open houses. Maybe you could quickly touch on that, because I know we send a lot of our prospective clients to speak to you first, to make sure they have all their ducks in a row, and make sure from a professional standpoint they understand what they need, because that can be very different from what you need from an immigration standpoint, which is what we handle.
Yes, so we do have on a monthly basis, we do offer sessions about the programs and the services that AIMGA offers, and then we specify, the practice. We have a session specific for the practice readiness assessment routes, and so there's currently 7 routes across Canada, and and the eligibility criteria for those different routes. And like I said, there's only kind of 2 provinces that look at specialists, for example. And so Alberta being one of them. And, Alberta also does have the largest practice readiness assessment route, program. Let's say we do sort of license approximately 100 physicians every year, and that is increasing, and both specialists and family practitioners. So it's really important to understand the practice readiness assessment routes. And then if you're not eligible for those routes, which I don't, think that, most of the people that you deal with, would probably be eligible for a practice readiness assessment route. But if you're not eligible for that route, then the only way that you can become licensed is by redoing residency training in Canada. And so that's where, a lot of IMGs, are struggling, or, that's a very competitive process to compete for seats that are made eligible for internationally trained physicians. And that's where the journey can be quite long and frustrating for some. There have been many people that have come and managed to get a residency seat sort of in 1.5 to 2 years, but that would be the shortest time frame. And so we do have an orientation on that as well. And there are some doctors that immigrate to Canada that may not be interested in pursuing licensure, depending on the process and their background and their specialty, and they may have had a rewarding career in medicine already. And so we have helped some people sort of go into alternative career pathways where they can utilize their skills and knowledge in other ways. And so those orientation sessions happen on a monthly basis, and we're happy to, have anyone participate in those in order to increase their understanding. And then we have career advisors that people can meet with individually afterwards to talk about their specific education and the current pathways and eligibility.
Okay, fantastic. Elizna, I'm going to leave the last word to you. A lot of the people who are going to be watching this video are in the South African market. Just from a personal perspective, moving your family there, leaving your family. What's your advice to doctors from South Africa looking to go to Canada?
My advice would be make very sure, when you make your decisions that you want to give it a go, because it's not just a decision taken lightly. And it really does help if your family is supportive. Like my family back home, they have been supportive from the day that we told them the news that we're considering the move to Canada. That helps a lot. So make sure that you, in your mind, are ready for, changes, because there is a lot of changes here. You can't just replant your entire professional and adult life and family life from South Africa to Canada within a couple of months. It does take adjustment. So far, I feel it's worth it. I'm really loving working here and living here, and I'm not having any regrets so far. But do as much research and make sure for yourself that you are ready to adjust from how you've lived before, because it is different, and that you're willing to adapt to a slightly different way of living, not in a bad sense. It's just things are done differently here. There's a different mindset, there's a different culture. So if it's a good fit for you, I mean, if you're a outdoorsy person, by all means, many of these opportunities, like in my case, offers a fantastic work-life balance. You get well compensated, obviously. And in my case, my family has been very supportive, coming here, because my spouse is not a physician, and he was on board since day one, even before I got my head wrapped around being willing to do exams again. After you swear you will never do a medical exam ever in your life again, and you have to get your head around that. You have to compromise. You can't be rigid in your way of thinking, because Canada is extremely regulated. It's extremely well, I won't say organized, but things also change. And things change on a regular basis. And at the moment, things are changing, I believe, for the better, for doctors coming from South Africa in particular to Canada or interested. They're really making the process as seamless as they possibly can without compromising on patient care, obviously. So have your mindset ready if you are considering it. Make really sure this is what you want. Have the support. Make sure all your ducks are in a row, as you said, because everybody's pathway is unique. I cannot give you the step 1 to 10 of how to get here, because my pathway might be completely different to a different anaesthetist or general practitioner in South Africa wanting to come over right now. Well, not worlds apart, but still, there's certain steps that will be unique to you and challenges that will be unique to you in your pathway. So just if you have decided already, do your research, take it one step at a time. It is a big ordeal, but you get through it day by day. And I'm only here just over 6 months in the country now, and I mean, we have really settled down roots. I love my work environment. I think I've adjusted and integrated really well in the workplace. We settling down. We bought a house now. You can see beautiful fall colors behind me. So, and the townspeople here are really very welcoming. People here are friendly. They actually want you here. So, yeah, that's really, for me, a fortunate position to be in. And yeah, I think for a lot of people, if they're in the right mindset, they've got all their ducks in a row, they're willing to take the process one step at a time, even if it takes a couple of years to get here. Also, make sure you bring a lot of savings. Yeah, because it's not, I think, for the faint-hearted. You're gonna sacrifice a few things, but I feel at the end, if it's right for you, it's worth it.
Okay. Dr. du Plessis, I want to thank you for participating in today's webinar and giving insight into your journey. More so, I know that the Grande Prairie community was desperate for doctors. So I know you're going to be there to help people and probably save a lot of lives. Equally so, I want to thank Deidre Lake from the Alberta International Medical Graduate Association, providing an invaluable service for both international doctors and Canadians, to try to just help integrate people and to make sure people get the medical care they need. So I wanted to thank you both. The AIMGA information and their website and general contact info will be at the bottom of this video. And feel free to contact Beaver Immigration on any issues related to work permits, permanent residency, express entry, and the various immigration pathways. And I just want to thank everyone, wish everyone the best of luck on their journey.
Thank you so much.
Thanks, Deirdre. Thanks, Elizna.
Thank you, Nicholas, for having us.
Take care.